Tim's big question before the break.
Well, first of all, let me say that the end game of all this and why a private plan would work, before I get to the actual answer of that, is that we have to have doctors and hospitals who have skin in the game in terms of competition and incentives to drive costs down. Currently, it's just the opposite. Our payments are artificially depressed, and therefore we're incentivized to increase volume. And of course, lack of tort reform is also part of that. On the other hand, patients need to be part of that equation, and the way to do that is, as was mentioned, HSAs and other things where they actually have some skin in the game. With regard to the 900 or so billion that the President says he has found, we know that the Democrats and the President have been floating for months ways of getting this, and it's through alternative taxes like cap and trade, which would yield about $640 billion, but it'd make your light bills go up $3,000 a year, taxing sodas and such nonsense as that.
Yeah. Let's get a call. Brendan is on the phone. Brendan, do you hear us?
I do.
Brendan, go ahead, ask your question. What do you want to know?
Under a single-party system like some in Congress are advocating, other countries that have done this have effectively had to ration health care to control costs. Do you feel like that as Americans, that's something that we can accept? For example, an elderly man is not entitled to the same amount of resources as, a 25-year-old that's injured in a motorcycle accident.
Terry, you were shaking your head. You want to grab that?
Yeah. I think this caller has absolutely put his finger on it. With the aging population and the number of people that will require, and we now have the treatments, tremendous treatments, from everything from heart valve replacements and so forth to treatments that can keep people in their 80s and 90s living longer and better lives. And that's what we're coming to. That's what they have de facto done in other single-payer systems. They ration it by making you wait. And if you're severely ill and you can't wait, then you die. And in Canada, when I was there last week, again, the headline was, after you're diagnosed with cancer, you wait on average 4 weeks for surgery. I mean, they don't, if it's a mastectomy that's required, lumpectomy, you don't get to go in the next week and get that surgery. You're rationed. And that kind of rationing, either by forcing people to wait or by declaring certain age limits, don't get certain treatments, is something that I don't think Americans ever want. And we shouldn't have to have, if we have a growing economy and a competitive system that brings out the best in both the people who use the system and the people who provide the health care.
But I agree with her.
Yeah, but guys,
ultimately, in this country, again, it gets back to what I was saying. We can't have an unlimited amount of health care, can we? We can't. I mean, at what point?
Why?
No, you can't.
Because the cost will go through the roof, which is what we've witnessed.
And Joe was saying it earlier. Joe, let's throw this out to you. We were talking about this. You need to take personal responsibility. So if I am in charge and if I have to pay for things more, I will make conscious decisions. But I shouldn't be limited on my choices.
No, it's not limited on the choice, but they're going to have to. It's either going to. But Trace, you're talking about a system, and Joe, you can get in here, of where all the burden is on the individual to make decisions. And are we ever going to get to see that?
We're missing a key point, though. Let's go back to Terry's point. With an older population, the healthcare system would stand to make more money if they continued to deliver care, because if you look at just plain old demographics, those are the person that would be the most afflicted in our society. So you'd have to shrink the delivery model, and then you'd have to get the younger persons in the system paying premiums. Okay, that's the only way. You look at the United States demographics, that's where this is going.
Joe?
It is, and that's part of the problem. One of the assumptions that we continue to make is that America is expanding. And when you look at the economy, when you look at the people it produce, it is actually contracting. On the other hand, the people that are going to be using, they are expanding. That baby boom, that shift that is going through. And we keep making assumptions that the economy is going to be larger, there's going to be a larger tax base to use, there's going to be more revenue. And guys, it just doesn't look that way if you take a good, honest view at where we are inside of the world. And the challenge is we don't know as Americans how to say we're going to save this person and let this person go over economics. but we're leaning in that direction, and we're going to have to go there. And what we're going to do is, you can't look at the doctor you go to church with on Sunday and him look at me and go, Joe, you know, I love you, I love your family, but we just can't treat Kendra, your daughter, right now, or Kaylee, my other daughter, right now. We've got to treat this other person right now because this is what the chart says. And what's going to happen is they're going to try to remove that and put that in the hands of government, which I have no desire at all to tell my doctors how to treat me and my family. And if I want to spend more money to get fixed, then I'm going to spend more money to get fixed. It's got to be
Joe,
my choice.
I'm in your camp, and we could talk about this all day. So we're going to move on to an email. We got James in Utah. He writes, will I be forced to buy into government-funded health care?
Based on what the administration is saying, no.
Right.
However, Congressman.
Big however.
Well, remember that, and this is a little known fact, but we providers deal with this every day. In 1986, Congress passed a law, a mandate called EMTALA, that requires that if someone reports to the emergency room, we are required to treat them regardless of their ability to pay. And so the mandate has been on the providers, and the cost is passed on to the taxpayers and those who pay insurance premiums. I suspect that under the President's plan, once you appear in that emergency room, the first point of care treatment, the first treatment center that you report to, you'll be automatically enrolled into that system.
Joe, what do you think? I mean, I think that we are still going to be struggling with this.
It is, and if you think about it, and Congressman, with all due respect, I understand the scenario. You know, I get to be the Monday morning quarterback and talk about a problem. Y'all got to try to fix it.
Yeah.
But I mean, here is the deal. When you talk about forcing people to pay premiums now who don't pay premiums now, all you have done is decrease the cost of coverage for each individual. The total cost is still there, and as our population ages, it is going to continue to go up. You know, I sit on a board of the finance committee for one of our hospitals in the state of Indiana, and it is interesting watching some things that come in that are ways that we can save money if we can change some of the rules. So don't give up the ship. There is hope. I'm just not sure the hope is letting Washington control my doctor visit.
You know, Tim, I will say this though. Like when my kids were little, you know, I used to bring them to the doctor every third minute, it felt like, and a lot of people did that because, well, it's only $10.
Right.
Got a little $10 copay, check them, just make sure it really is the sniffles and these days not the swine flu, and then I go home. I mean, so this is something we have to start to prevent.
Absolutely. But the other side, we haven't talked about this too, but using nurse practitioners or paramedical professionals.
Because they're
correct.
Arguably cheaper than doctors.
Arguably cheaper. There's ways, and Joe could probably go further on this. He didn't get a chance to say it, but the point is there's ways that you can deliver care in a less expensive way, all right? And that really, if I'm not mistaken, Congressman, I believe the President's plan, which I agree with, is to try to also modify how health care is delivered using medical pairs.
That's a large part of the savings
right.
that they're...
But that makes sense,
you're
doesn't
correct.
it?
And just so people know, a nurse practitioner has another degree on top of being an RN.
Right.
So
That's
she's
right.
like that, he or
Yes,
she that much closer to being a doctor.
Yeah, in my own practice, we have 3 nurse practitioners, and they're very efficient providers. But you have to understand, if you don't deal with the root problem that's causing the fraud, waste, and abuse in the system, it doesn't matter whether you have lower paid providers. You're still going to see inflation rates twice that of the economy.
But, Congressman, fraud, waste, and abuse is an all-weather issue. I don't care if Tim's paying for it or the government's paying for it. I mean,
I
we clearly
disagree.
we need to eliminate
We got fraud, waste, and everything in every sector, it seems,
Exactly.
these days. All right, well,
we got to go,
we got
Congressman.
to jump to a break. We'll come right back. It's Saturday morning, and we're here live to answer your questions. Call us, 877-249-9626, or email us, yourmoney@foxbusiness.com.
In the next hour, questions about housing and real estate, getting a mortgage, refinancing your mortgage. You call us, we'll answer. Plus, Democratic Congressman Joe Sestak of Pennsylvania will join us with reaction to everything you want to know. Don't go anywhere. We'll be right back.